Thing that I like about it the most is people with pre-existing conditions can get coverage. So my sister was affected by that. My sister has ulcerative colitis. She was diagnosed as a early 20-something when she was still on my parents' insurance, and then she was not able to get insured by anyone for years.
I don't know if I'm too pumped about the Affordable Care Act. I haven't done my research, but from what I can tell of it, it more or less does two things. It makes it mandatory to have health insurance, and also provides a cheaper version of health insurance. I'm all about the second thing, the latter, but making it mandatory to have health insurance, I think, is a really bad idea.
I can't roll in the exchange just because I have Medicare. And one thing, like with Medicare, is that it only covers women's pap smear and pelvic exam every 24 months. And so a woman isn't fully protected with Medicare, and also Medicare doesn't have eye or dental either. So even though I have both Medicare and Medi-Cal, I don't get complete health care.
As far as like general health goes, I kind of feel like it's up to me to keep that maintained anyways. So to rest or like transfer that responsibility onto doctors and pay insurance so that I could be less careful and get really lax about health, I don't think that makes sense to me. I don't know.
I don't have a pre-existing condition, so it doesn't matter to me and my family. But in general, like the insurance cost, it's higher than before. It's a way to get insurance, get covered, but I just don't think like it will get like a huge saving like for the regular like resident.
It won't affect me all that much. It should really cover more people and more services, and not have to have everybody pay a lot of money and everything, because we want really single payer or some other thing that everybody gets health care for free, or just pay taxes for it if you can afford it.
I think that there's been a lot of propaganda and maybe the wrong message that has been communicated, because ultimately, as a whole, the society ends up paying for the uninsured people anyway, right? I'm not so sure that anybody's done the math or that anybody's communicated it correctly, but I actually believe that economically the country will be better off